The Sierra Health Foundation and their center actually work collaboratively in pursuit of health equity and racial equity across California's Central Valley. It is designed to kind of aggregate funding, human capital, intelligence, and to combine that with the power of community to really push for changes and improvements in health across many of the most marginalized communities in our region. Now, our orientation over the past 7 or 8 years has been around the social determinants of health. And embedded in that particular framework is our belief and pursuit of health equity and racial equity. We know that health is about more than just your access to clinical care, and we know that race and place has a huge impact on what your health outcomes are likely to be. We are always working in partnership with community. Some of the extraordinary partnerships that we're part of here at the Sierra Health Foundation and at the Center at Sierra Health would be California Funders for Boys and Men of Color, 18 foundations working to improve the economic, social, and physical health of that population across the state of California. Another example would be the San Joaquin Valley Health Fund. 90 organizations who've created their own policy framework for change. Our work around a positive youth justice initiative, where we're using the best of brain science to understand how to transform a system that's been largely focused on punishment to one that's focused on the healthy development of young people.
We knew that the future of Stockton is related to the future of California. The center actually saw that long before a lot of other funders and philanthropists and actually acted on that. And really, as a result of that, we've been able to now exponentially grow the organization from where it originally was at. That has actually given us the opportunity to realize our vision for Stockton.
There's a defining moment in our community that required all of us to lean in, from faith-based organizations to grassroots CBOs, community-based organizations, to foundations, to city, to the county, all coming together to respond, to stop our babies from dying, to stop third-party homicide, to be able to offer resources and services to moms that need some support in carrying their babies full term, right? And the Black Child Legacy campaign is a result of that multi-sector collaboration built to save lives. One of the greatest things the Black Child Legacy campaign is continuing to do is envision what resources, what services need to happen in order to get in front of saving lives and reducing African American childhood death.
The various forms and health inequities that plague vulnerable communities are very important for us to prioritize and create community-led best practices around. So the Center at Sierra Health Foundation plays an integral role as a backbone intermediary support team. The Build Black Coalition comes out of a desire for there to be change in our community, a real authentic desire for there to be change in our community. Build Black absolutely was started because of the police shooting incident of Stephon Clark. And it will continue to live on because there are many, many more incidents like that that need both attention, time, and a strategy to bring people out of that level of trauma. And if we can do those things, that we can instill strategies to help people tap into that, see themselves in that, and build a stronger community, then Build Black would have done exactly what it was supposed to do.
You know, I think that the center's role has been so important beyond the actual investment, the financial investment. Really, the opportunity to grow, I've become part of the family, if you will, and they become part of our family. And so we have a reciprocal relationship. As a matter of fact, I can tell you so many different programs and trainings that we've been through that have actually gone above and beyond the actual dollars that have been invested. The actual human investment, the relationships with the center have proven to be the most, I think, important beyond the financial investment.
And so what does the future hold for us? I think this is what we're most excited about, because over the past 4.5 years, we've learned a lot. Now we have the opportunity to deploy those lessons in new ways, to engage new partners, to expand both the depth, scope, and impact of our work as we go forward. And we, the collective we, all the funders, communities that we get to work with, the extraordinary relationships that we built with elected and other public officials, now we have the opportunity to drive for change that is deep, meaningful, and lasting.